Hello, my name is Kevin Corcoran. I'm president of Corcoran Consulting Group and founder of Corcoran Compliance Connection. Today I'm going to describe the features and benefits of Corcoran Compliance Connection. Corcoran Compliance Connection, or C³ for short, is a web-based compliance and coding program for electronic medical records from Corcoran Consulting Group, a leader in reimbursement consulting for ophthalmologists, optometrists, and other eye care providers. The goal of Corcoran Compliance Connection is to improve coding, compliance, reduce risk associated with fraud and abuse, and increase practice management efficiency. Corcoran Compliance Connection is automated, secure, and HIPAA compliant. Corcoran Compliance Connection is an expert system that provides fast, online responses about proper coding and chart documentation. C³ suggests accurate codes for eye exams based solely on the electronic medical record entries and without physician interrogation. C³ provides recommendations for evaluation and management codes, I codes, and HCPCS S codes as appropriate, more than any other coding system available today. It significantly improves compliance and prompts users in challenging situations. We live in a time of rapid change in healthcare. Many ophthalmologists and optometrists are presently looking for a new EHR system because CMS has mandated electronic medical records by 2015, or financial penalties will apply. There is increasing scrutiny of medical records and reimbursement payments after the fact to root out fraud and abuse and not waste money. With all of this emphasis on accurate billing, the Office of Inspector General of the Health and Human Services Department strongly recommends a voluntary compliance program for individual physicians and small groups. For hospitals and some other healthcare providers, a compliance plan is now mandatory. Corcoran Compliance Connection can help support a strong compliance program. With all the pressures they face, all of our clients are looking for assistance. They ask, how do I ensure that my charting and coding are compliant while maximizing revenue per patient? C³ was designed to reduce risk and increase revenue. Because Corcoran Consulting Group has decades of experience with chart reviews, we looked at the last 800 chart audits we performed and found some interesting data points. An average ophthalmologist collects about $50,000 per month. Some are more, some are less productive. An average claim is reimbursed $100 to $200. Since no practice is perfect, we find a variety of errors in billing. 26% overpayments, 10% underpayments, 9% coding errors, and a small number of date errors. We quantify these errors in two ways: how often they occur and how many dollars are involved. We find that 39% of all claims have errors. Only 61% are correct. The errors amount to 4% of collection dollars. If not corrected, the errors pose a risk to the practice of fines and penalties equal to 3 times the value of the claim plus thousands of more dollars. C³ can dramatically improve this picture. In our chart reviews, we also find that most ophthalmologists and optometrists do not bill eye exams correctly. On average, 70% of all office visits are coded correctly. Some visits, usually the lower levels, tend to be billed at a level that is not merited by the chart notes. On the other hand, some visits are underbilled, usually the higher levels. On balance, eye doctors underbill more than they overbill due to many factors, but mostly because coding is difficult to get right. This is exactly why C³ was created, to reduce or eliminate this problem. Based on our chart reviews, we find that an average ophthalmologist or optometrist would benefit from using Corcoran Compliance Connection in two ways: reduced underpayments through erroneous coding and reduced overpayments through better charting. In this slide, we estimate that C-Cubed would, at a minimum, improve revenue and profitability by 1% of collections. In this slide, we estimate that C-Cubed would, at a minimum, reduce the risk of overpayments by 3% of collections. Taken together, we estimate that C-Cubed would generate a cumulative financial benefit of 4% of collections. How does C-Cubed work? We start with the electronic medical record itself. From it, we gather data elements that will permit C-Cubed to determine the right codes to describe an office visit and related ancillary services. Those elements are transmitted in a secure, encrypted file to the C-Cubed website, where our proprietary expert system generates a response with the recommended codes. There are 62 standard elements per encounter from the electronic medical record. There are 5 additional elements for each diagnosis, 5 additional elements for each diagnostic test, and 7 additional elements for each surgical procedure. The output from C-Cubed contains a lot of information. Where appropriate, C-Cubed provides an evaluation and management code, an I code, and an S code. If the chart note does not support one or more of these choices, it's not recommended. When an ophthalmologist or optometrist is given several choices at once, C-Cubed stratifies them so that the one with the highest value is easy to pick. Just like a super bill, C-Cubed identifies the primary diagnosis as well as the supplemental diagnoses. Where necessary, modifiers are provided. Ancillary services, such as diagnostic tests and surgical procedures, are also addressed. Here is an illustration of the C-Cubed output for the office visit coding. This part of the C-Cubed output provides the user with the underlying reasons for the coding recommendations of an evaluation and management code and an I code. This part of the C-Cubed output deals with diagnostic tests. This part of the C-Cubed output deals with surgical procedures. C-Cubed also provides hints and warnings in the form of messages. They advise the user when crucial data is missing or not verified, when no code is supported by the electronic medical record, a message is sent that explains why. For example, an I code requires a treatment, and when there is none, then an I code does not pertain. An evaluation and management code requires a history of present illness performed by the physician, and when it isn't noted, then an evaluation and management code does not apply. The user can read the message and know what needs to be done to improve the chart note. In some difficult situations where there is a significant chance of error, C-Cubed provides warnings. The use or misuse of modifier 25 is a good example. I began developing Corcoran Compliance Connection in 2011, and now it's ready to provide 24/7 support that would not be possible in traditional consulting. It's only available through our electronic medical record partners. There are several, and the list is growing. Visit our website for a current list of partners. Customer service support is provided by Corcoran, a leader in reimbursement for ophthalmology and optometry with more than 25 years of experience. Most importantly, Corcoran Compliance Connection provides you with peace of mind. Now, let's take a few seconds to answer some of the most frequent questions about Corcoran Compliance Connection. Is Corcoran Compliance Connection HIPAA compliant? Yes, protected health information, or PHI, is not disclosed by Corcoran Compliance Connection. Do I need to buy any additional hardware? No, your present EMR system provides all the hardware that is necessary. How reliable are the answers provided by Corcoran Compliance Connection? From a coding perspective, the codes suggested by Corcoran Compliance Connection are 100% reliable. However, the Corcoran Compliance Connection responses are based solely on the information in the electronic medical record, which should reflect medically appropriate services. There is every expectation that it does, but no guarantee by Corcoran Compliance Connection. How can Corcoran Compliance Connection help if my practice is audited? Corcoran Compliance Connection ensures that coding for office visits is accurate within the definitions published in CPT and HCPCS. If broader assistance is needed to rebut criticism during a post-payment audit, then Corcoran Consulting Group can help if desired. How much does Corcoran Compliance Connection cost? For pricing information, contact your electronic medical record vendor. Corcoran Compliance Connection is only sold through them. How can I get a demonstration of Corcoran Compliance Connection? Several electronic medical record companies have partnered with Corcoran Compliance Connection, and several more are in the process of doing so. For those EMR companies that have already agreed to work with Corcoran Compliance Connection, a demonstration is easy to arrange. Otherwise, call us and we'll find a way to provide the information you seek. I hope you enjoyed this brief introduction to Corcoran Compliance Connection. For further information, please visit our website or call us on our toll-free number. Thank you.